Hi, this is Justine Calderwood, physical therapist at the Healing Spot Physical Therapy. I have my pelvis here today, and it's an articulating pelvis, so it moves around, and I want to show you a little something about your SI joint. Okay, so the sacroiliac joint is in the back side. Okay, so I know you can't see the spine on this model, but I want to talk a little bit today about the SI joint because I'm seeing a lot of low back, people with low back pain, hip pain, growing pain. That's primarily what I'm seeing right now, and why I'm looking at the SI joint, okay? And I wanted to bring some attention to the front side here, the pubic bone, okay? Because a lot of therapists aren't checking this. And I just recently learned some great techniques that I've been able to incorporate into my practice through the work of Lynn Schulte. She's a physical therapist in Longmont, Colorado. She works out of the Boulder and Denver areas, and she has an Institute for Birth Healing. And I'm telling you, I did this birth certification training with her this fall, 61 hours of coursework. And it was for pregnant and postpartum mom care, and learning how to better treat moms that are pregnant and postpartum. But I am finding, I'm telling you, so many great techniques that I learned from her that I'm able to use with my male patients and even my female patients who haven't had kids, okay, that are having SI joint pain, low back pain, hip pain, especially like groin pain, okay? So when I'm saying groin pain, like into the groin crease, okay? So I want to share this information because I'm not going to, show you exactly how to do it. You're not going to be able to like go and treat somebody doing this, but I want to bring some attention to this because I've been a physical therapist for 16 and a half years, and I learned a lot of great new techniques that I'm helping my patients with. So what I'm going to try to show you this on this video, but what I'm going to do here is, so just bring awareness here to, this is the bony ring, okay? So, kind of as you're standing up here, this is what it looks like, okay? So it's forward like that, and you got your hip bones here. So if you just put your hands on your hips, whoops, you're going to be on the ilia. Okay, so if we flip that around, so this would be the back side, the ilia come back and they attach on, or they connect, meet up with the sacrum. So that's called the sacroiliac joint or the SI joint, okay? So hopefully you can kind of see this, but let's say you're walking and your hips are swaying, right? So you'd be probably more like this, but you got to have a little bit of mobility through there. What I'm seeing is a lot of people, and I'm not going to talk specifically about birth healing and the open birthing pattern that Lynn teaches about and what I learned about. I want to just make this really general, so you can understand this. So this is, works for all populations, but you got to be able to have a little bit of mobility there. And what I'm finding is a lot of people are stuck. Okay, so they don't have that mobility there, and I check this with someone lying down on their back. I would check it, hands here, and I'm checking for mobility. And what I'm finding through the hips is that one side is kind of feels stuck, feels like it's just sticky in there. So what I will do then is look further at mobility of the sacrum. Okay, so what I'm looking for is the ability for the sacrum to kind of do this rotation, okay, and also to be able to glide. So I'm just checking that, doing just a spring test, okay, to do that, and I'll just treat those areas that are lacking mobility. So I'm not really looking for pain, I'm looking for lack of mobility, and I'm fixing that. And then the same thing here. So if you can kind of understand that sacrum has to be able to tilt a little bit, there has to be some mobility through there, okay? So if you're stuck, one side's jammed up, of course that's gonna hurt, okay? But if we only look at, what I'm finding though is if we only look at the side that hurts, guess what? You're gonna miss lack of mobility on this other side because, I find it all over the place. People have left-sided SI joint pain and their right side is stuck, okay? Or vice versa. Or it's stuck up here high on the left, but it's moving, really well on the bottom, but it's not moving on this right side, okay? Under, like over the ILA, which is this like kind of angle, okay, of the lower part. All right, and then also just checking that that glide, okay, so that you have that full mobility there. Again, I'm not chasing pain because that's not a great indicator on where the dysfunction is. The other thing that I'm looking for is mobility through the pubic symphysis. So if you look at the front side here, the ilia, the sacrum, and then the front side, it makes this ring around to the pubic bone, okay? So I will check mobility there because even though that's a fibrous joint there, it meets up, it's not fixed, okay? So you can get a little bit of shearing, we call that shearing, where it moves just a little bit back and forth, okay? And also up and down. I mean, you have mobility through here. And if you don't, it's gonna lead to pain. So what I'm doing is as Lynn taught me, checking mobility there, doing this kind of spring test at the pubic symphysis, and also coming down between the legs. So obviously I don't have a person here, but with this model, I would come between the legs and come to the pubic ramus. So the pubic symphysis is here, pubic rami, or ramus, that's plural, rami are here. So I'm also checking how well does this glide up, and what does that feel like in the bone itself. And if there's been some strain there, the bone actually feels hard, okay? Which sounds funny, right? It's like, yeah, bones are hard, but they should have a certain springiness to it, and I can feel that with my hand. And then also checking these sits bones. So, you know, when you're sitting, obviously, that's why they're called sits bones, ischial tuberosities, but I'll also check mobility there, and we'll check, you know, kind of spring test. We'll see if they're splayed open, which will happen a lot of times with the open birthing position. So if you are a mom and you're having lingering back pain, you know, this is something I would check with you. But, you know, again, go on your history. If you're male, haven't had a baby, that kind of thing, but you should still have that mobility. So that's all I wanted to cover today, just the mobility through the pelvis, not even going over the muscles or anything in this video, just strictly mobility. So if you are working with somebody right now and you aren't getting better, or things just aren't changing in your SI joint pain, your back pain, your hip pain, you know, or if you even have, you know, maybe some pelvic pain, if that's not changing, you know, look on Lynn Schulte's website. Well, yeah, her website, she has a directory of people that she has trained in these techniques. You can go to Institute for Birth Healing. She also has a Facebook page, and you know, it lists people in your area. If you are local to Woodland Park, Colorado, I highly encourage you. Just give me a call and see, we can talk and see if I can offer some help to you. Okay? All right. Thank you, guys.